Good morning again. This is the second lecture. المرحلة الثالثة كلية طب جامعة نيسان about tapeworm. Intestinal tapeworm. Humans acquire tapeworm by eating undercooked beef infected with the larva stage, Tinea saginatum, undercooked pork, beef or pork containing the larva stage of Tinea solium, or undercooked freshwater fish containing larvae Diphyllobothrium latum. Usually only one adult tapeworm is present in the gut, but up to 10 have been reported. Some of these organisms are primarily human pathogen, while others are animal as their nature host. Intestinal tapeworm, Tinea solium, solium means from the pigs, has a rostrum and 2 rows of hooklet on the scoliosis and discharge multiple proglottids, 3 to 5 attached together with lower degree of uterine branching, approximately 10. Tinea saginata has only 4 suckers in its scolex and discharge single proglottids with a greater uterine branching, up to 30. So how we differentiate between Tinea solium and Tinea saginata? This is the body of Tinea solium and this is the body of Tinea saginata. So a lot of rows. What about scoliosis or the head? Look, 1, 2, 3, 4 suckers, 1, 2, 3, 4 suckers, looks like the same. Number of segment, these are different in the segment of Tinea saginata and Tinea solium. Number of segment is more with Tinea saginata. This is gravid proglottids, more branching than Tinea saginatum. What about Cysticercus? Cysticercus cerealis and Cysticercus bovis. These are the difference between the two. In general, this is a, let us say, a box to show the biological difference between Tinea solium and Tinea saginata. This is the length, 2 to 4 meters, Tinea saginata 4 to 8 meters, scoliosis 1 millimeter diameter, 2 millimeter diameter, 4 sucker. Number of segments 700, 1000, mature proglottids 3 lobes, 2 lobes, gravid proglottid 7 to 13, 15 to 30. Number of gravid proglottid attached, usually several, usually single. Mode of proglottid, passing out, passively expelled, actively migrate out of the anus. Cysticercus, scoliosis with hooklet, no hooklet on scoliosis, found in man and pigs, only in cattle. Disease caused in man, teniasis, and cysticercosis, teniasis. Cysticercosis life cycle. We start with first, as you notice, this is the infective state and this is the diagnostic stage. So oncosphere develop into cysticerca in the muscle. Oncosphere hatch, penetrate the intestinal wall and circulate to musculature. Cattle, Tinea saginata and pigs become infected by ingested vegetation contaminated by eggs or gravid proglottids, and then from this can be transmitted to the human by ingestion of raw meat from both these animals. Tinea solium, the adult worm, is found only in human following eating of undercooked pork containing cysticercae. Nicotinamide followed by mild laxative to prevent retrograde intestinal autoinfection is effective for intestinal infection. So this is the drug of choice, nicotinamide. About the prevention, cooking pork will prevent intestinal infection. Great care must be taken by nurse and other adult while attending a patient harboring an adult worm to avoid ingestion of oversegment. Diphyllobothrium latum is observed predominantly in North Europe and Japan. The latum infection has been transmitted by consumption of raw fish, water fish. Megaloblastic anemia due to vitamin B deficiency is a classical manifestation in which the patient presented with pancytopenia atrophic glossitis, and even if it is long-standing, can be presented with neurological manifestation as subacute combined degeneration of the spinal cord and even ataxia. The diagnosis is generally established by identifying the eggs or probiotids in the stool, so diagnosis is easy. What about hemolymphomas H. can be transmitted between a human in the absence of intermediate host, is associated with poor sanitation, disease of poor socioeconomic status, most commonly in children. Most infections are asymptomatic, but if they have infection, they give us diarrhea, abdominal pain, and perianal itching. The diagnosis is generally established by identifying the eggs or probiotids in the stool. This is egg of H. A to D, A, B, C, D. These eggs are oval and small than those of Diminuta, the size ranging from 30 to 50. On the inner membrane are 2 balls, from which 4 to 8 balls filaments spread out between the 2 members, and it has 6 scoliosis. Treatment: praziquantel, treatment of choice for tenus aginatum, dilatum, and H. Nicotinamide is an acceptable alternative for praziquantel. If praziquantel is not available following therapy, stool should be rechecked for egg to assess cure. These are the eggs. The eggs of tenus aginata and tenus oleum are indistinguishable. The eggs are spherical, diameter 31 to 48, with thick, redly stained brown embryon. This is cysticerca. This is muscle specimen, and this is cysticerca. Cysticerca in myocardium. This is heart muscle, and these are the wall. Cysticerca. Cysticercosis. Human cysticercosis is acquired by ingestion of tenus oleum, tapeworm ova, from either contaminated finger or food. The larvae are liberated from the eggs into the stomach, intestinal mucosa, and carried out to every part of the body, develop and form cysticerca about 1 centimeter cyst size that contain head of young worm. They do not grow further or migrate. Common location is subcutaneous tissue, mainly skeletal tissue and brain. When superficial placed, can be palpated under the skin or mucosa as pea-like ovoid body. They have caused few or no symptom and will eventually die and become calcified. Heavy brain infection can lead to encephalitis, especially in children. More commonly, however, cerebral signs do not occur until the larvae die, usually 5 to 20 years later. Epilepsy, personality changes, staggering gait, or sign of hydrocephalus are the most common presenting feature. Now the cysticercus in the tongue. This is the obvious one. And this is cysticerca in the eye, usually found in the vitreous body. Subretinal, visual disturbance, the main clinical feature. Cysticerca of the brain. The symptoms are related to the site of the infection. The patient may manifest headache, nausea, vomiting, epilepsy, paralysis, weakness in the limb, diplopia, dizziness, mental disorder. Epilepsy is the most frequent symptom of cysticercosis. So any child in these in the Western countries, as you know, the pork meat habit, ingestion. Any child with history of fit, brain CT or brain MRI is essential to exclude the infection with this worm. This is a brain time, diffuse brain affection, and this is a death patient. Investigation: calcified cyst in the muscle can be recognized radiologically, so it is very easy to diagnose it by simple X-ray. In the brain, however, less calcification takes place, and larvae are only occasionally visible on brain X-ray, usually we need CT or MRI. Epileptic fit starting in adult type suggests the possibility of cysticercosis if the patient has lived in travel to endemic area. Subcutaneous tissue should be palpated and any nodule excised for histopathology. So it is easy to be removed and sent for histopathology because it is subcutaneously. Radiological examination of skeletal muscle may be helpful. Antibody detection is advisable for serology. So this is radiological examination of the skeletal muscle. This is plain X-ray. Plain X-ray of patient affected with cystic fibrosis. This is the lesion, not subcutaneous calcification. This is a lot of lesions. Subcutaneous calcification of the cyst can be diagnosed early by biopsy from this lesion. Management is albendazole 50 mg per kg daily for minimum of 8 days has now become the drug of choice for parenchymal neurocysticercosis. Praziquantel is another option, 50 mg per kg, free dividing dose daily for 10 days. Prednisolone 10 mg 8 hourly is also given for 14 days starting day 1 before the albendazole or praziquantel. And the role of prednisolone is to prevent allergic reaction occur during treatment for this one whenever they are present in large number. Operation or intervention is indicated for hydrocephalus. Hydrocephalus obstruction of the CSF passages is difficult to be treated medically only, so there should be bypass for the CSF passages, so treatment is by shunt. So hydrocephalus is a neurosurgical treatment mainly. By this, I thank you very much, and I hope you enjoy with me the lecture.